RTHK Radio 3.
You're listening to Brunch with me, Noreen Mayer, on this Thursday morning. Now, in the next 20 minutes or so, we're shining a light on a topic that affects many, ADHD in adults, and also its impact on romantic relationships. And I'm really delighted to be chatting once again to clinical psychologist Correctelaine Zaidi. And with her expertise, we'll find out how ADHD manifests in adult life and also perhaps the challenges that it poses in relationships and some effective strategies couples can use to strengthen their relationship. Welcome back on the program, Dr. Zaidi. Thank you so much for being with us today.
Thank you for having me.
And we are live this morning on Facebook. So if anybody has any questions or maybe you have some effective communication styles that you can share with us, get in touch. Noreen Mayer on RTHK Radio 3. So let's perhaps clarify what ADHD is, how it manifests in adults, and what are some of the common symptoms that you've come across, Dr. Zaidi?
So, and I think it's a very good starting point because there is so much misinformation out there. So it's important to be able to focus on how we diagnose and what the current criteria are for diagnosis of ADHD. So it is classified into three main types based on predominant symptoms that we see. So predominantly inattentive presentation symptoms usually revolve around difficulty maintaining attention and focus. For example, frequently making careless mistakes, difficulty sustaining attention in tasks, conversations, seeming not to listen when spoken to directly, struggling with organizing tasks or losing items unnecessarily, like water bottles, keys, umbrellas, being easily distracted by external or unrelated thoughts, forgetfulness in daily activities. So that's the inattentive type. Now, predominantly inattentive type. Predominantly hyperactive, impulsive presentation is slightly different, which is, fidgeting, tapping hands, difficulty staying seated, restlessness, unable to remain in one place, talking excessively, blurting things out, and that's different. That's the difference between the hyperactive, which is you're kind of bouncing off the walls. Typically, we put that for the boys rather than girls. With the girls, it's more about the impulsivity, about just being able to say things without thinking about it, interrupting others or intruding conversations, difficulty in engaging in quiet activities, and acting impulsively without consideration for the long-term consequences. You can't think beyond here. Whatever is right in front of you is what it is. And then there is the combined presentation. And this is the most common type in both children and adults, which is combination of both inattentive and hyperactive, impulsive presentations. And to be able to diagnose this according to the DSM-5, which is the Diagnostic Statistical Manual of Mental Disorders, fifth edition, for symptoms for the inattentiveness, it is at least 6 symptoms out of, however many that we're looking for. And it has to be present for 6 months. In adults, it is 5 that we're looking for hyperactive impulsivity. Again, 6, anybody who's younger than 17, 5 for anybody who's older than 17. The most important thing that we forget is that symptoms must have been present before the age of 12. They must be present when you were younger because it is a neurodevelopmental disorder currently. That's where it is. That's where it sits. And it must be impacting in 2 or more settings, for example, work or home, school, and in your social life. So that it has to be present in a multiple variation of it. Has to be impacting your life in different settings, not just in one place. So, and it has to have an impact on your reducing the quality of your social life, academic life, or your occupational functioning. So those are the things that we look for. That is the diagnostic criteria.
That's great. That's an absolutely great starting point, Dr. Zaidi. And out of curiosity, do you get many adults or do you see more and more adults sort of self-diagnosing themselves or coming to you to be diagnosed to see if they have ADHD? Because you mentioned they have to have been diagnosed before they were 12, but perhaps it wasn't so common back in the day to be diagnosed. What's your observation?
So you don't have to be diagnosed before 12,
Oh, I
but
beg your
it has present
Sorry.
before you were. So, it has to be present in childhood. So it's not suddenly that you're becoming forgetful because you're an adult now, or you're disorganized because you're,
Or
in
more
your
fidgety now. Or yeah, it had
yes,
to be
it
sure.
had to be present before you were 12 years old. So that's why it's called, as I said, neurodevelopmental condition. So it persists from childhood. And, hyperactivity usually decreases with age. Symptoms of inattention, impulsivity, and emotional dysregulation often
We have
remain.
better
This,
control.
yes, yes. And more adults, especially in the last 24 months, have been reaching out to me to be able to get the diagnosis for this, because they are becoming more aware of it, and they feel that, and I would say that 80% of them are correct when they reach out. They know that this has been underlying, but it has always been there. It's not suddenly that we've now lost we've become inattentive because of the phone.
It was always there.
Right.
And it must be a relief for some of them to just finally have an answer. So, and just to make links why this, may have impacted my work with organizations, or why am I more forgetful than my peers. It must be a relief. Back to romantic relationships. What about the challenges faced by partners? I mean, we've talked about the person with ADHD. What about the challenges faced by partners who are in a relationship with a person who has ADHD, or may display symptoms of ADHD?
Yeah, so look, you've got to remember that these, and I'm very familiar with it because it's like firsthand experience I have, of it. I'm the boring one in the family, but I'm kind of surrounded by people with this in different manifestations. So
I'm nodding too.
so yeah, look, they have strengths which boring people like me don't. The creativity, the innovation, the out of box thinking. It is just so
Being spontaneous and that cheerleader. Yes,
amazing. It's
amazing.
amazing to be with that, and most of the time that is great to have. However, it does get in the way sometimes when you're frustrated and tired, and you've told somebody what is happening tomorrow, and then you wake up in the morning and you're about to leave the house and you're like,
Oh,
so what's
what's on the.
happening
Yeah.
again?
Yes.
So that frustration can creep in about the forgetfulness, about the impulsive decisions, about the inconsistent follow through on the commitments that were made. And then the other part is the emotional dysregulation. I mean, my personal experience as well as my professional experience is that it is very quick to get angry, have the emotional outburst, and then you kind of calm down very quickly, and you've left the other person in the aftermath of, oh my God, what
What?
happened?
Yeah.
So it
Although
can.
I may be that person with the outburst, and then the other person takes a longer time to
Yeah,
regulate. Because it's true. I think maybe people with ADHD are able to have bigger feelings and then calm themselves down in a shorter space of time, whereas the other person's more of a constant.
yeah.
What
And they
about
forget. And
what
they
about the
forget.
communication style then? Does
Yeah.
that impact the communication style?
It kind of, because distractions during the conversations can make the non-ADHD partner feel unheard or dismissed. That is the biggest thing. Or impulsivity, where you're causing it, where you're interrupting the other or blurting out comments, sometimes does lead to misunderstandings and feels like, I don't have space to be able to even speak. So, and then the other part is the hyper focus. When you're hyper focused on something that you're interested in, that can lead to intense connection, but may shift unpredictably as well. So it is that constant unknown, right? And it's not knowing the consistency. It's the lack of consistency that can lead to differences in the communication styles.
What about strategies for couples then? How can they improve their relationship dynamics? What sorts of strategies can they adopt to manage this? Can you truly control these behavior, for example? Make yourself more attentive or make yourself more relaxed. As an adult, are we able to sort of control these impulses?
You can certainly work towards it once you recognize it. And this is why, when people come to me for diagnosis, my first question is that what is it that you're going to do with that diagnosis? Because it is important to understand what's going on, and then what is it that you're going to do about it? Because you can't use it as an excuse. Oh, I have ADHD, therefore I'm not able to do this.
Just getting
That,
the diagnosis and then the be all and end all. That's it. That's why I'm like that.
yeah, that's not what it is. So yes, things that can, as long as you're I think in any relationship, right, as long as you're consistently making an effort to improve in whatever your shortcomings are, and we all have them, right, that's the important part. So being open and honest about ADHD and its effect on relationship, using tools like shared calendars, reminders, managing responsibilities, because one person can feel like that they're carrying more of the administrative role or more of the more of the organizational part of the relationship than the other party. So, and being able to establish clear roles and limits to ensure that there is a balance in their relationship tasks and sense of responsibility. So, for example, for me, the person who's ADHD is very interested in organizing holidays and being able to
Wow.
take charge of it. So, you know what? I just turn up and it's just an easy thing
Brilliant.
to do. Yeah, right. It's interest based. So you've got to remember things that they're interested in, just hand it over to them. It's much easier, much easier.
You're so supportive, Dr. Zaidi, and give them the free reins. And what about how can partners sort of be more supportive of each other? Maybe one is better at time management, the other isn't, or maybe organization skills. Not to say you're not organized, I'm sure you are, but maybe because if the other person is more interested in our partnership, how can we be more supportive of each other's and respect our skills?
I feel the first thing is that having compassion and patience for your partner, because they're not deliberately losing the 100 umbrellas, right?
Yes.
I think we're in thousands now. I think 7-Eleven have done really well with the umbrellas in Hong Kong.
I've lost a fair few, maybe not in the thousands, but yes, they're easy to lose because you go out and it's raining, and when you go indoors, and when you leave the place, it's not raining, so it's easy to forget.
Yeah, but it's just being able to laugh about things like that, because it's not the be it and the end of it all. It's important to be able to focus on what's important and work together to be able to have better communications about things that do annoy you and frustrate you. And there are times when, if you're running out of patience, then being able to give a heads up to your partner, listen, I'm really running out of patience, so please try harder currently. So it's important to be able to recognize it's not a character flaw. Setting realistic expectations, focusing on small achievable changes, and they might change because consistency is hard, and being able to constantly communicate, I think, is the most important thing, and create some humor with it, right? Really, honestly, that's the only thing you're going to see.
I like that, the empathy and just having the compassion and communicate. What about when it comes to conflict? How can we manage conflict? Because everything is in the heat of the moment and the communication style might be different. How can partners sort of navigate these ADHD symptoms during a conflict?
So it's going back to, again, the basics, being able to use I statements, which is I feel, describe the situation, about the situation, I'm frustrated about, the loss of the umbrella again. And can you please try next time not to lose it, because that was my favorite one.
Yeah,
Right?
yes,
Something like that.
exactly.
I don't mean to be dismissive, but it is about being able to communicate your needs in a way that,
Without blaming, yeah. Because
without blame.
I love the way you summarized it. It's it's not really a character flaw. They're not doing it on purpose. There's no malice in it. They're not trying to upset you by behaving like this. Just off topic slightly, Dr. Zaidi, what about, have you seen sort of one couple, both with ADHD? Is that common, or is it a case of opposites attract? Or can you both display sort of ADHD symptoms? I don't know. I'm just trying to think of my circle of friends. It is usually opposites attract. It is usually one who's a bit more hyper and then the other one's a bit more quiet. I don't know if I've met two hyper. I'm sure maybe I'm limited in my circle of friends. I don't know.
It's not very common that I see two impulsive ADHD partners, but I have come across inattentive and mixed, the combined type, and but fewer in that combination. It's more one neurotypical and one neurodivergent.
Yeah.
To of the practical work that I've seen, it's I would say about 75, 80, even 80% is neurotypical and neurodivergent, and then maybe inattentive and the combined type.
Yeah, agree. Even just by looking at sort of
Yeah,
dynamics between couples. Friendships, on the other hand, might be different.
yeah,
Friendships, you
yeah.
tend to flock together. And that would be kind of, yeah, I mean, that's why people have fun together. Yeah.
Yes, possibly. I mean, I think, but in couples, I haven't in my own, and that's a very good question. I will continue to keep a lookout for that. So yes, but
Yeah.
I haven't seen, like, I can't say it's 50-50.
Yeah, I agree. And I suppose friends don't really come to therapy together because I guess they manage their conflicts on their own. Although maybe there should be friendship therapy because friendships do break up. Maybe that's a topic for another day. We're just coming up towards the end of the segment, towards the news. What advice do you have for overwhelmed partners? I think part of it is time and experience. You see over time and from experience you can manage. What about people in new relationships who are just, in a long term connection, a long term partnership? What advice do you have for someone who's just overwhelmed and who has to constantly pick up the slack?
I would recommend really being open and honest about your partner about how you're feeling, and seeking professional help if it will be helpful. Because if you're not getting through to your partner at that moment in time, then you do need to be able to get some help. And being able to, as I said, I hold on to things, I remember things. These people forget things. They will wake up tomorrow morning and it'll be, it's a new day again, kind of thing, right? And I wish I had some of that. So just being able to focus on positive traits like as I said, being spontaneous, creative, and the passion and the excitement that comes with all of these people in your life, right? But it does, if it leads to feelings of disconnection, and if they're not managed effectively, that's when you really need to put in interventions to be able to repair that, because it does depend. Long-term relationship depends on mutual understanding, empathy, and consistent effort, as I've always said. And that is what needs to go into any relationships, especially when there is neurodiversity involved.
Yeah, how can without putting the label, but how can perhaps the partner with ADHD check in with the other partner? Is that kind of a good thing?
Yes,
Yeah.
yes, absolutely. Put a reminder
Yeah.
at, at 6 o'clock on a Thursday.
Yeah.
Make sure that you text your partner to say, hey, listen, I was just thinking about you. How are you feeling?
Yes.
Right? Just check in. That's it. That's
Yes.
it. If you can't remember, and being consistent is important. I think reminders are usually helpful. They
Exactly.
really are helpful. Yeah.
And if you forget what the reminder is about, set yourself another reminder to say, oh, that reminder is what it's about. Meanwhile, Dr. Zaidi, it's always, always a pleasure to have you on the program. Thank you so much for sharing your expertise. And today we talked about ADHD and also managing ADHD related challenges to improve romantic relationships. Thank you very much indeed for your time once again.
Thank you for having me.